I'm Phil Cardoso, an associate professor at the University of Illinois.
And I'm Stephen LeBlanc, professor in the vet school at the University of Guelph in Canada.
So we are here through Zoom, and we are talking about one thing that just came out, that is the new Horst Dairyman book on dairy cattle fertility. And Dr. LeBlanc has a chapter in this book, and the chapter relates to health of fresh cows, right? So maybe we can start talking, Stephen, on how did you come up to start writing the chapter?
Yeah, so it's an area of research that we've been working on for quite a few years, and as we get, in other parts of the book dealing with other aspects of repro management, as we get better and better control of programs and technologies for inseminating cows and for trying to optimize their fertility right around breeding, understanding that we really want to set them up for success. We can have the best synchronization program or the best activity monitors or the best inseminator, but if the cow has lived through a really difficult metabolic experience or health experience in the transition period, that's going to make it much harder for her to get pregnant and stay pregnant. So we've been working, and lots of other people have been working for quite a few years on understanding some of those links. So we know transition's super important, but maybe we're only starting to understand better is what the cow lives through even before calving, at calving, and the weeks after calving makes a big, big influence for her, even 2 months, 3 months later when we're trying to get her pregnant. So things like, to take one example that we've done a bunch of work, ketosis. So maybe 40% of cows live through subclinical ketosis in early lactation, and depending on the severity, duration, and so on, that has different effects in the short term. And even if you did nothing about it, the ketosis would eventually go away. So the cow's not ketotic anymore when we go to breed her. But what we've learned is that the fact that she lived through that before makes a big difference, or at least it makes a difference to her fertility later on. So we talk about some of the ways to monitor and treat and so on.
I remember a lot of previous research where you kind of was, determining, hey, what is the concentration that is associated with some of these disorders? Like I remember displacement of abomasum, and then going to commercial farms and drawing upon a lot of blood samples before calving, after calving, during the transition period, to determine, especially focus on NIFA and BHB. Even at that time, I think Precision Extra and blood ketone bodies was something that was available. And then that was something that was done before to kind of capture those associations, right?
Yeah, that's right. We've got a bunch of really good tools now that are actually practical and really accurate for producers, advisors to check the ketosis prevalence and status of their cows. And the handheld blood meters that are designed for people with diabetes, those work really well for cows. There's milk test strips, and now in many areas you can get milk BHB testing with your DHIA testing as well. The problem with that one is if you're only doing it once a month, you're going to miss some important information. But in any case, there's lots of ways to monitor that. And yeah, again, we've done a whole bunch of those big studies on commercial farms to try to identify those cut points. Really roughly on the blood, it's going to be around 1.1 millimoles per liter. That's the cut point that's associated with increased risk of bad stuff, be it disease or worse fertility. In milk, it's the absolute concentration is lower, so it's going to be around 0.1 millimole or 0.15 millimole. But again, that sort of puts the cow in a bit higher risk category. One of the big debates is always, a high-producing cow makes some ketones. That's part of how she adapts to support herself, to move some body weight to support milk. So to a point, a little bit of ketosis is actually a good thing, but at a certain point, if they're doing that too much, it kicks them into a higher risk category for bad stuff in the short term or the longer term.
I see. And then using specifically BHB after calving for subclinical ketosis or ketosis characterization, right? Then in the book, in your chapter, you mentioned about three strategies or three cutoff points, or for people say you have your cow with ketosis, and then if she is with BHBA greater than 1.2, but below 2.4 millimoles, that you would do propylene glycol. And that, did you experiment with liquid versus powder, or that would not matter? I don't know. Which one did you use in
yeah,
research?
so that those recommendations are mostly based on a couple of really big trials on commercial dairies in Canada and the US that were done by my colleague Jessica Gordon. And yeah, so we lay out that so-called moderate ketosis, where the blood BHB value in the first 2 weeks postpartum is between 1.2 and 2.4. The initial treatment would be 3 days with glycol. If it's higher than that, the initial treatment would be for 5 days, and then you recheck and see if it needs to be continued. But that was all done with liquid drenching of glycol. We didn't compare the dry products in those studies, but the work that has been done by other people in the past would say, for sure, for therapy of ketotic cows, it looks like that bolus effect of the drenching seems to be necessary and seems to work better. If you're talking about prevention, the dry products may work okay. For sure, they're more convenient because you can just put them either in the diet, or some herds now through robot feeding. That's another strategy. But for therapy, it seems like that bolus effect with drenching seems to be important.
I see. And then for research purposes, you draw blood from all those cows enrolled, but that commercial farm right now, for example, are they doing some kind of a subsample, or did they go to keep doing it in milk, or what they are doing now aside from the research, just to practice?
Yeah. So several of those farms, not all of them, but a lot of them have kept going with individual cow testing, some with the blood, some switched to doing the milk test strips that you do by hand. They found that a little more convenient. They could do it in the parlor. And either of those work quite well. As I said before, the DHI milk ketone testing is really convenient, and for sure having that information is much better than nothing for kind of a herd level trends from month to month. But because you're only checking the cows, once every 4 or 5 weeks when you have a DHI test, yeah, it's much better than nothing, but it's not really good enough for picking individual cows and so on. So in a large herd, for looking at trends over time, it's a nice tool. In a smaller, medium-sized herd, or even in a large herd, it doesn't really get you to that individual intervention, which is probably where a lot of the value would lie.
Mm-hmm. And then one thing that I found pretty interesting is that if you have the cows have blood BHB greater than 1.2 and glucose less than 2.2, then we would have an injection of 5 milligrams of vitamin B12 for the days in addition to the treatment with propylene glycol, as you described the other two before. So why would that be the B12 plus? Now you are checking that glucose and BHB relation.
So that was, I mean, not totally surprising, but that was the first time that a large study had added this information about blood glucose in ketotic cows. And what we found was that among the ketotic cows, a little more than 1/3 of them also had low blood glucose. I mean, all fresh cows have pretty low blood glucose, lower than a person, but kind of normal for a fresh cow. But ketotic cows, again, about 35% of them have really quite low blood glucose. And that's a bad thing for them. It turns out that all of their outcomes, milk and subsequent health and so on, and likelihood to cure from ketosis, was all worse if they were a low glucose cow. And a couple of other research groups have since found the same thing, that about 35% of ketotic cows also have low blood glucose on top. And so we used a commercial injectable product that had a few ingredients, but it seems the key one is vitamin B12. And interestingly, the biochemistry of how that works is not completely understood, but the hypothesis is that the B12, well, we know that the B12 is an important factor in a couple of the enzymes in the TCA cycle. So to make a long story short, it looks plausible that in those low glucose cows, we give them the B12, and perhaps it's helping make up a little deficit in their ability to generate energy in general and glucose in particular.
A few years ago, you were testing the idea of being able to do glucose with the same precision extra that I'll do with the BHP. We just change the type of strip and be able to do that. Yep. Was that validated, or, in this research specifically, did you use serum for that, or you did the handheld machine to detect glucose as well?
Yep. So we, in this study, it was the same little handheld machine. You just pull out the purple strip and stick in a blue strip and put a drop of blood on that right on the spot. And previously we had validated that was pretty accurate compared to the same blood sample going off to a diagnostic lab. There's a couple of other research groups that have worked on that since. They've suggested that maybe if you're really trying to get the exact blood glucose level, you might need to make a little adjustment factor to the number. But certainly what we found is it's more than good enough to add some information and add some value on the spot with a very simple direct use to help add some information when you diagnose these ketotic cows.
Mm-hmm. Anything else you want to talk about the chapter that I didn't cover?
No, I think maybe just that bigger thing is that if anybody needed it for one more good reason to want to focus on health of transition cows, it's that there are these long-term effects out to their ability to get pregnant and stay pregnant, and so it's like a double benefit. I mean, we want to do this monitoring and treatment because it has benefits directly for health and milk and culling, but it also has some benefits on the table for fertility.
Okay, then going more specific on the fertility, I'm gonna pull another paper that just came out in Thyrogenology. Is that right?
That's right.
Yeah. First author, what's his name again?
So Osvaldo Pascottini.
Osvaldo Pascottini. And you were talking about the metabolic markers for PVD, purulent vaginal discharge, and subclinical endometritis in dairy cows. So one of the clinical diseases probably could be ketosis as well, but it includes retained placenta, metritis, DA, mastitis as well as being classified as non-healthy, right? Yep. And so you had healthy cows that had only PVD, and cows that had subclinical clinical endometritis. Do you call them SCE or you call them subclinical, or you just say endometritis?
Yeah, well, so there's a
because PVD is easy. SCE doesn't sound good. I don't know why.
So okay, let's just call them subclinical endometritis, or even just endometritis if you want. But yeah, there's a little bit of let's say controversy on exactly how to work out the case definitions and the jargon. But I think the concept we're trying to get at with that paper is, okay, healthy cows have no detected reproductive tract disease. The PVD, or purulent vaginal discharge, are cows that we found with the MetriCheck, and you know, you and your student a few years ago did a really nice video of how to use that tool to detect cows with that pus discharge in the repro tract. And then last but not least are these cows that would be negative on the MetriChecks. They don't have pus, but if you go in the uterus and do cytology, you can see that they have this chronic low-grade smoldering inflammation. So we call that, well, that means endometritis, and we call it subclinical because if you just look at the cow, and even if you look at the vaginal discharge, there's nothing there. So it's truly subclinical. You can't see it, but it's there. And so with this paper, we were trying to understand a little bit more in depth about what was going on metabolically with those cows, because our concept is that, and that's more or less what the data supported, these are probably kind of different versions of reproductive tract problems that the cows had. So it used to be, we thought, okay, yep, some cows have this smoldering inflammation in their uterus that we call endometritis, and if it's bad enough, then they'll actually have pus coming out through their cervix that we could see sometimes just by looking at the cow, or if we do a MetriCheck or something. And long story short, over the years, we found that at the very least, that's not the whole story. Maybe for some cows, that's the story, but for a bunch of cows, they have pus, and so they've got a reproductive tract problem for sure, but it may not be because they have uterine inflammation at that moment. Some of them just have cervicitis. That's still a problem, but it's maybe a different problem. And then there's these other cows that don't have any pus, but do have inflammation. And so we're trying to figure out what's up with that. And the other piece, not from this paper, but from some other work that we've done and other people too, if you try to do or if you do a culture or even check the microbiome of these different groups of cows, there's differences there too. So the pus cows, the PVD cows, kind of do what you expect. You would get pathogens that you would grow from them, usually one called Trupperella. Their microbiome looks different than healthy cows and different than subclinical cows. So that kind of all makes sense, and we often treat those cows with antibiotics, and that story pretty much makes sense. But it's the other ones that we kind of still scratching our heads, because in those cows, we often don't see a difference with the microbiome. If you cultured them, you don't really grow pathogens, yet they're inflamed. Why are they inflamed? What's going on with them? And so again, long story short, we're seeing these pieces of evidence that these cows have some metabolic differences, and it seems like they're just not able to control or to fine-tune their inflammation, in particular in their uterus, as they recover after calving.
In 2014, we were in Ireland, and there was the, what's the name of the company? I think it was Fertility, in that West Coast, I think, was it?
Yeah, Westport, Ireland, yep.
Yeah. And then I remember you have a very nice paper that came out after that conference in Animal, talking about a hypothesis on subclinical endometritis and saying, hey, healthy cows, they do have a higher, I'm not sure if a higher or an appropriate response in the beginning of the lactation, but that kind of really goes down with days where the cows that have the problem, they even are going to react too much or high for a longer time. Yep. Or they're not going to respond because they cannot build that response. So you still think that's the case, that it's a matter of building up to immune response, but there is a moment where that goes overboard, and then that's where cows start getting the symptoms and association with infertility and other things. And maybe here you are trying to pinpoint some of the biomarkers that may be indicating, hey, overboard here.
Yep.
Okay.
Yeah, no, that's exactly right. So at this point, it's kind of a, I don't know, call it what you want, a theory, a working hypothesis, but yeah, we still think that's a direction, or that seems to be the case for at least a group of these cows. So yeah, the healthy cow should have a big, robust, effective flux of inflammation and immune response to her uterus in the days after calving, first week after calving. But then the job should be done and things should be settled down within, I'm going to say, roughly 3 weeks. For sure, there's some cows that just don't get the job done. Their immune response is too weak, too slow, not effective. Those are probably the cows that go on to have metritis, full-blown sick cow, or perhaps less obvious, but still in the same boat, maybe the cows that end up with PVD a month later. But then these cows with this kind of more subtle yet still important subclinical endometritis, either they don't turn down that inflammation when they should, and that we think that's somewhere in that 2nd to 3rd week postpartum time. And so again, that's kind of the hypothesis, is that somehow inflammation just stays at an excessive level. And so why? Doesn't seem to be because of bacterial infection. So that's why we're poking around other stimuli in the cow that would be keeping the dial turned up on inflammation, and we're seeing it in the uterus, but maybe it's true in the rest of the cow. And so that was where some of these metabolic marker data we were interested in. And you know, it's not like a totally conclusive picture by any means, but this very recent paper, we were finding some additional pieces of evidence that would say, yeah, there's before and during this process, these cows have this ongoing heightened inflammation that doesn't seem to be helping them.
If I could highlight from that paper, 2 of those biomarkers. So one was haptoglobin, that kind of, you know, we do here in the lab. It's kind of a headache sometimes because it seems to have like a lot of variation by cow, right? It's a type of biomarker that is not very easy, straightforward, but it seems like when it's there type of deal, right? That's a very non-scientific way of putting it, but interesting enough, you saw, especially in that first week, you saw that the cows with subclinical endometritis, they responded higher to that than cows with PVD or healthy.
Yeah.
So that was kind of very interesting for me. And do you have a hypothesis, or why is that happening with those cows and not with the PVD cows? Like you just said, hey, we thought that was an aggravation of the subclinical endometritis. So
yeah. Well, so your question is exactly what we're asking, is why. I mean, that picture that you just described, it fits with our concept of the disease, that these endometritis cows are like cranked up too high or don't turn things down. But so why are they doing that? We don't really know, because it doesn't seem to be anything obvious, like, you know, they had a really tough calving, or they had a vulval laceration or some other kind of obvious trauma. It does not seem to be that. So we're actively doing other research to try to understand what it is, because it doesn't seem to be physical trauma. It doesn't seem to be the microbiome. So, you know, we're calling it how well they regulate inflammation. And that, I mean, that seems to be true, but it still doesn't explain, okay, that's nice, but why? Mm-hmm. I don't know why yet. So we're still working on that. And but yeah, that's the concept. And it fits. I mean, haptoglobin is an acute phase protein. When there's inflammation somewhere in the cow, it goes up, and interestingly, it's part of the initial response, and it actually ultimately contributes to turning things down in the medium term. So it's logical that it would be more elevated in these endometritis cows, given all this stuff that I'm talking about. But we're still trying to understand, like, okay, but what sets it off? What's the initiation? We're just about to start some collaborative work to see, well, some additional collaborative work to see, can we intervene with anti-inflammatory treatments to try to adjust the dial. The first experiment we did with that, we got some kind of really interesting results, but it didn't change uterine inflammation the way we hoped it would. So it's still a work in progress.
Mm-hmm. When you have the endometritis and you're collecting the sample, and what would be so you are measuring that proportion of those cells, like those polymorphic nuclears, and then what is so if we would do, I don't know, gene expression, right? What is the quality of those cells, or what are the metabolites that they are using versus the uterine tissue? It could mean that at that stage, that is just a signal that really it's coming through the whole cow. Whenever you have the PVD, is something that is a little bit more constricted, and then you don't have that huge signal going or coming back. That's kind of, I'm not sure, the eggs and the chicken, what's going on.
Yep. Yeah, no, that's and we actually just got some funding a little earlier this year to pursue exactly that, and that I would have put it the same way: the chicken or the egg, or in other words, is inflammation in the uterus contributing to the rest of the cow being in this state of systemic inflammation or metabolic inflammation, or maybe the other way around for other reasons, whether it's subacute rumen acidosis, whether it's leaky gut, whether it's some other stuff that we still don't really understand. But either way, is the whole cow in this systemic or metabolic inflammation, and then the uterus is kind of getting a bystander injury that, and we know about it because it's a place we go looking, but maybe the same would be true in other tissues. So that's something we're going to work on and try to use some experimental models to try to tease that apart, if we can experimentally induce inflammation either in the whole cow and see what happens in the uterus, or induce it in the uterus and see what happens, well, obviously in the uterus, but also in the rest of the cow. Because there's lots of groups now, from Barry Bradford's group and Lance Baumgart's group, and people in Illinois and people in Guelph and lots of others as well. We're all kind of checking out this phenomenon of systemic inflammation in fresh cows, and there's several papers out now saying that even a very short exposure to anti-inflammatories after calving can improve milk production for the long run. So we're kind of coming from different places, but trying to figure out where's the chicken and where's the egg.
Yeah, and it seems like you mentioned leaky gut, that I think we are more familiar with it in cows, but like say the leaky uterus, it's something very well described in the human literature, but it seems like that's not something that we've been thinking hard enough, I think. I think that's changing now with your research coming up and all this, but it's a place where we know from other groups, right, that the microbiome, the bacteria are there.
Yeah.
Right. So now if the cow develops endometritis or not, that's it's a second point. Just because they have bacteria doesn't mean they're going to get endometritis or PVD. I think that was you guys already described. It's very well taught. We know the bacteria and everything else. So, do you have, the other thing you saw that I found interesting was albumin, where the healthy cows, they seem to have, maybe starting at 2 weeks after calving, where they have a higher albumin concentration than PVD and subclinical endometritis. At this time, they both behave the same, with lower when compared to healthy cows.
Yes. So albumin is the most abundant blood protein, plasma protein, and it's also known to be a negative acute phase protein. So in other words, when the cow goes into some state of inflammation because for whatever reason, because she's lame or mastitis or pneumonia or metritis or anything, it's sort of really well known, haptoglobin is going to jump up, and a few other things too, but actually albumin will go down. The thing is, albumin is like some of the other, things like calcium and glucose. It's normally really tightly regulated. So the amount of change is really small. Like we're talking about going from, maybe 33, 34 grams per liter in the blood down to 32. Like you would think, wow, that's pretty tiny. Is that even important? It seems like somehow it is important to the cow, because the first study, at least that I can think of, that showed that association was some work out of New Zealand from more than 10 years ago. And they showed this pattern where endometritis cows, going back even, if I remember, before calving, they were always just a little bit lower in albumin all the way through. And then we found something more or less similar. So and in some other data sets as well. So I think it's real. I think it's pointing us again to this state of generalized inflammation. It's a marker. I'm not sure it's I don't think it's a direct mechanistic pathway that we're onto, but I think it's a marker of what's going on more generally and systemically with the cow. But it's some kind of cool biology, because it's a very small change, but it seems to be quite consistent and reproducible.
Anything else you'd like to highlight about this paper? Just fresh out of the press in theory. Yeah, actually, I got my one here. It says journal pre-proof. I'm not sure if you can see it.
There you go.
I don't think they even have the layout yet.
Oh, that's not even the pretty version yet, but there you go. Full marks to you. You're like getting stuff like the day it comes out, I think. So well done. Yeah, so I think maybe just to wrap up, like right now we have some very practical things with, ketosis monitoring, ketosis treatment, checking for cows with pus. We can, those tools are maybe still a bit crude, but they're way better than not bothering with it. So there's things we can do practically already right now in terms of monitoring, diagnosis, treatment. We know that's not the whole story. It's the tip of the iceberg. It's still useful. It's better than just ignoring it, but there's still a lot more that we don't understand. Like for example, these subclinical endometritis cows, that's easily 15-20% of cows. I mean, that's very, very consistent, different parts of the world, big herds, small herds. So it has a meaningful effect on fertility of cows. So it's not just a kind of cool science thing. It's pretty clearly got some, it's a piece of the fertility puzzle. So we've got some ideas about what's going on there, but we still got lots more work till we get to a simple test for the field, like we don't have a metra check for that or a precision meter for that, but maybe someday we will. And then same thing, once we get smarter about what's actually going on with these cows, whether it's anti-inflammatory approaches through medications or through the diet, we're going to get smarter and more precise about how we can adjust that dial in a way that's helpful to the cow.
Well, thank you very much for your time. I really enjoyed the conversation, and it seems like you've done a lot, and but it's refreshing to know that we still have a lot to do. So thank you very much.
That's a pleasure. Thanks, Phil.